My name is Phyllis Chavis, and my assignment for SIM 436 Activity 5 is to describe a health assessment tool. I'm going to identify the population and how it's different than my own. My target population for this health assessment tool is a low-income 60-year-old widowed Ukrainian immigrant, female with type 2 diabetes mellitus, who speaks Ukrainian and has no medical insurance. I am a middle-class African-American, English-speaking, single female in my 50s who works full-time with great healthcare benefits. I can easily access healthcare, afford it, and understand it. I'm going to discuss the importance of the health needs. This patient was one of my previous patients, was diagnosed with type 2 diabetes in 2007 and had an A1C of 9.1. She had minimal income, was unable to afford medical insurance, and she spoke little to no English. She was moderately obese at 223 pounds and was from a culture where heavy starches and lots of bread were part of every meal. I will cite Harkness and DeMarco by saying what people eat and how they eat varies with different cultures. Understanding this as a nurse is critical to good nursing care. Now, this population I chose not only needed access to healthier food choices, but also to have food examples from the Ukrainian culture that could be modified to healthier versions to help manage her diabetes, lower her weight, and decrease her A1C. I'm going to identify special learning challenges for this patient. This lady has learning challenges such as a language barriers, and financial concerns. She's unemployed. She lives off of her son's disability, and her son suffered a cardiac arrest event last year and has a noxic brain injury as a result, and he remains in the hospital at this time. She was purchasing food with what was left after rent and utilities were paid, and unfortunately that meant high fat, high carbohydrates, starchy foods, fast foods. Basically, it was just what she felt she could afford. Additionally, she didn't have any medical insurance. Once we started working with her, I was able to get her approved for our program, which is FAP, Financial Assistance Program, and this program allowed for uninsured people to get connected with a medical home and a provider. Her copay amount for her doctor's visits would only be $5, and if she was referred to a specialist, she would only have to pay a $20 copay. We then got her applied and approved for SNAP, food stamp benefits. Wasn't much, it's only $75 a month, but that was more than what she had been working with, and then it gave us a little leeway to be able to get her some healthier choices. We also got enrolled in our food share program, wherein she's able to purchase a $50 basket of fresh fruits and vegetables for just $15, and she could pay for that with her food stamps as well. Lastly, we were able to get her set up with Well Vista, a nonprofit organization that provides access to prescription medications to the uninsured through Well Vista's mail order pharmacy. This patient was on Invokana and glyphosate, so that was going to help as well as preserving some of her finances. And I suppose I should have started with the most significant challenge with this patient, the fact that she spoke little to no English. Addressing this first enabled us to successfully tackle the other challenges that the patient was facing. Every interaction with her entailed me calling the translation line to access one of the Ukrainian translators when her friend who did speak English wasn't able to attend her appointments with me. Then we'd have to do that. Now, once or twice the friend was able to come and that helped. It was still a lengthy process. A scheduled 30-minute plan of care review would quickly turn into 60 to 90-minute episode with updating information and reiterating educational instructions. When I look back at that whole process, just to label it a challenge is pretty much an understatement, because as you may have gleaned from the services I mentioned earlier that we secured for her, it was quite a chore, but it was worth it indeed at the end. I'm going to cite the American Association of Diabetes Educators by saying that a critical element to overcoming cultural barriers during patient-clinician interactions has to be effective communication. The use of appropriately trained and professional interpreters is a must when communicating with non-English speaking patients. The assessment tool I'm introducing would be something she could have accessed after our visits, and she could use that as reinforcement to her diet, her exercise, and medication compliance instructions. I'm going to include a description of the tool to teach the information and how it works. I am citing Rubenfeld and Schaefer. In this century, we have computers, cell phones, the internet, and videos to access healthcare information. If used correctly and positively, they can benefit our patients. In this next century, the study of informatics will be crucial in the practice of medicine. Now, the health assessment tool I would like to develop would be a YouTube video with a Ukrainian speaking dietitian, nurse, or health coach to reinforce a diabetic diet and demonstrate recipes to this Ukrainian population with ingredients familiar to them to benefit her diabetic status. She would be able to use her cell phone provided by the government to watch these videos to learn how to eat healthier foods. I mentioned before that the Ukrainian people enjoy a diet high in starches and breads. With the YouTube videos, she could understand the right foods to buy at the local produce markets and how she could modify her recipes to simulate many of her cultural dishes, but just a healthier version. And then with our program, we also provide as incentive to our patients for getting their numbers better, whether it's their blood pressure, their A1C, their weight. We provide these gift cards for extra phone minutes, so that would also benefit her. Now, the patient would be instructed to go to the YouTube and view the videos, and it would also share these web addresses to links to sites with information on visual aids, such as some of the handouts I have here, like on the Russian healthy plate, and it would have it in her language, and then also, would give the English version of that. Then we would have like the Russian bowl, because they do a lot of soups and porridges, so that would be in her language, as well as a copy of a Russian menu, like a week's menu of items so she could set up her meals in advance. And it would also have, finally, the blood sugar management handouts in her language as well as in English. So the site would provide for that. Now, the tool itself would instruct her to go to your phone, look on the internet, and these instructions would be provided for her in Ukrainian as well. And then it would tell her that to open the search bar at the top that has a picture of the magnifying glass. Then she would put in the words health assessment tool diet for diabetes and the Ukrainian patient. Then it would have her, then she could look at the video on diet and recipes and exercise. Then she could watch how they prepare the meals and then, learn from that tool. And then it would teach her other foods to eat and how many servings that she should eat in a day. So all of that will be included in that tool in teaching and reinforcing. And I would stress to her, and it would stress to her that suppose if she just committed to trying this for 3 months and taking her medications as prescribed and exercising, if only a brisk walk daily for 20 to 30 minutes, and the impact this would have on her diabetes. It would make her feel better, and she would feel better at the end of that 3 months for sure. Weight would change, and her numbers, A1C, would definitely come down if all of those three things were done, and she was committed to doing that. All right, how does the literature support this use of technology? I'm going to cite Rubenfeld and Schaefer. There's a rapid growth now in technology and informatics. This growth is due to the rapid rate of change and the increased sophistication of the technology we promote to share and use information. The Institute of Medicine called call for 3 important informatics targets that will contribute to improved quality of care, decision making, recording information, accessibility, and information communication. Now, how does this tool contribute to critical thinking? We can use open-mindedness and flexibility when utilizing this tool, which means changing how we have been doing something to how we use the new technology, such as I would prefer to have just written this paper and turned it in, but I'm doing this video because that's what's required. So that's a use of new technology and going out on a limb. We also need intuition, which can help build up one's decision and use of informatics. Without intuition, we cannot use technology. We also need to maintain perseverance. We need to accept our amateur status regarding informatics, and then confidence is a critical thinking dimension required to with this tool, since we need confidence in our ability to think and figure out the unknown. The patient population I chose can use all these critical thinking dimensions when using this tool. Now, how does the tool contribute to nursing practice and patient outcome? I will again cite Rubenfeld and Schaefer. This tool can benefit the nursing practice and patient outcomes since it is transforming knowledge by analyzing it, sorting it, communicating it, and converting it into a practical, usable form. Evidence-based practice and informatics go hand in hand, and it is the use of informatics or this tool that we can transform the evidence into practice. The nurse can use this tool to teach and reinforce the Ukrainian patients how to change their diet and learn to cook healthier foods in their culture. The outcomes can be positive and beneficial to both the nurse and the patient. And finally, to describe the impact of technology on nursing practice and patient outcomes, information technology is changing every day. I will cite Ainsley and Brown. Informatics engages new uses for information technology to offer solutions to specific problems in areas from biology to fine arts. Informatics is not just interested in how individuals transform technology, but also how technology transforms individuals. Nurses who become skilled in using technology and databases empower themselves to retrieve information to make sound decisions based on current research rather than just their opinion. Nurses benefit from the accomplishments made by using information systems in hospitals, managed care, and clinics. This use allows for updated standards and uses computer-based materials for clinical and patient teaching, making sure computers effectively document the nursing process and ensure quality patient care. Nurses must rely on their knowledge and skills to provide quality patient care. Thank you for your time.